You can get the most out of your orthodontic treatment through proper flossing and brushing of your teeth. This will take a few minutes after each meal. Carry floss and a toothbrush with you. There are 3 zones that are at risk for decay and gum disease: around your brackets, at the gum line, and between your teeth. If you do not brush and floss your teeth properly while wearing braces, scarring and decay can occur. These are not stains. This is an early sign of tooth decay and cannot be reversed. You can avoid problems like this by properly flossing and brushing your teeth. Now that you have braces, a floss threader will help you in flossing your teeth. Take 12 inches of floss and tie it to the threader. Next, slide the threader under the wire, hold on to the floss, and drop the threader. Floss between your teeth, curving around each tooth with a C shape. Make 3 scoops on each side of every tooth, going slightly under the gum line. Repeat this process with the lower teeth. Don't forget to floss behind the back teeth. When brushing your teeth, first brush the chewing surfaces of your teeth with a back and forth motion. Then, brush back and forth across the brackets to loosen the food particles. Next, gently brush the outside of your teeth with the bristles at a 45-degree angle toward the gum, being sure to get the brush under the arch wire. Do the same on the inner surfaces of your upper teeth. Repeat this process with your lower teeth.